Hi everyone, I hope you're doing well. In today's video, I will be speaking about some common birthmarks that you might encounter on your baby's skin. There's so many kinds. They're just a discoloration of skin. Most times they're not even anything that harm the baby. So I wanted to go through some of the common ones that I've heard about and to give you some background in it so that you don't panic or worry about these things. So number one, the first one that I'd like to speak about is salmon patches. They're also called stork bites, and these are usually pinkish areas that are found on the back of the neck, the forehead, the face generally, or the eyelids in particular. And this is really caused by blood vessels in the skin, and about 33% of all light-skinned babies have stork bites, and most will fade from your baby's skin within 18 months. There's very few that are permanent, but most will fade. So if you notice that pinkish tone on the spots that I mentioned, don't worry about it. Look into it, especially if it's past the 18 months mark. The second one that I'd like to talk about is strawberry marks. These are often more of a redder tone. Some are pinkish, and they're a little bit more raised and spongy. These might actually not appear until a few weeks after birth, or they might continue to grow sometime during the next 6 to 12 months. Most disappear by the age of 10, and they don't leave a scar, so don't worry about it. That's usually 6 to 12 months is when they might grow, but they will definitely disappear. Number three, the next one is Mongolian spots. They are flat. They tend to be blue or grayish colored marks. Where they kind of look like bruises, to be honest, and they're found on baby's back or even their buttocks. They are more often seen on darker skinned babies and Asian babies. What causes them is a high concentration of pigment cells in the skin. These are not a sign that baby has a disease or anything like that, and they should fade during childhood. But most times, these don't really disappear completely. So that's just a heads up, but there aren't any kind of harm to baby. The next one is called cafe au lait spots. They're usually more of a tan or light brown in color. They can be found really anywhere on the body, and they're usually permanent. There isn't any real treatments for these spots, but if baby has more than 6 spots that are a larger size, they should definitely be checked out by the doctor. Because they can be found in conjunction with a rare disorder, a neurological disorder. So get that checked if you spot more than 6 and that they're a fairly larger size. The next one is port wine stains. They are a little bit more pinkish to purplish red colored tones, and they're also usually flat. They fade somewhat, but they usually are permanent. They can be removed by laser surgery when the baby's grown and much older, of course. If port wine stains appear anywhere on the face, they should be checked on regularly. Port wine stain on baby's forehead especially, or eyelid, may indicate Serge-Weber syndrome, which is a neurological disease, and it's important for your health practitioner or doctor to keep an eye on that and look on that much closer than any other one of the syndromes that you might notice. Sorry, I meant symptoms, not syndromes. The next one is called the spider navy, and this is really dilated blood vessels that look like a spider web. They usually fade by 1 to 2 years old. When the baby reaches that age. Moles or pigmented navy come in several colors from light brown to even black. They are usually caused as an increase in the number of pigment cells in the skin. Moles represented at birth should be watched out for any kind of size or color. Just keep an eye on that. Larger moles that are over 3 inches wide may be removed to avoid the risk of melanoma. But keep an eye on birthmarks that your child may have. Call the doctor if birthmarks grow or change colors. If a mark is close to the eye or a baby's face, your doctor will check on it for sure. In most cases, birthmarks are really watched to see if they fade and go away on their own. A laser surgery is used for many instances to remove birthmarks and moles. Other treatments are possible depending on the specific case, but make sure to discuss it with your baby's doctor if you're concerned. A lot of the ones I mentioned do fade, and they are the more common ones, so keep an eye on that and your baby should be good to go.